Richard Acton, can we ask you to come forward, Richard, and tell us about keeping golfers well? I hope everyone's okay just to hang on to their appetites just for a little bit longer, and we'll perhaps make up some time later. Richard, thank you very much.
Thanks. Thank you. Fine, I'll do. Thank you. I'll try to keep it as quick as possible, because I appreciate it is lunchtime. So, but bear with me, because I'm going to take you back to June 2020. I'm sorry. It was towards the end of the first wave of the pandemic. We were just coming out of isolation. There was the rule of 4 or the rule of 8, or however many you wanted if you were in Westminster and having a party. Vaccines were still a distant dream. Infections were high and testing was taking days rather than hours. Yet golfers wanted to get back to playing. So in order to do that, we needed to develop an agile and speedy test process. So my name is Richard Acton. I'm the Chief Scientific Officer for Signpost Diagnostics. I'm going to be joined by Patrick Robinson from Edinburgh University. And we're going to talk about how we kept players well through the pandemic, and also how that has evolved through the period and what next. So how did we get players playing? Well, first of all, thanks to the work of Charlie Foster, Dr. Murray, Patrick, we developed a concept of a secure bubble. And that was together with the public health leaders. What that involved was a series of interventions before players and tour staff and caddies could get into the secure area of the golf course before a tournament. So what they needed to do was get a PCR test and get the result back within a few hours rather than a few days. They also, once they were in the bubble, they weren't allowed to leave. So it was a secure place where everybody had been previously tested, and they conducted daily questionnaires to make sure that they were still healthy. So getting a result back in a couple of days just wouldn't work. So third-party laboratories taking samples off-site wasn't an option. Science was moving slowly, and we needed some agility. So Signpost suggested a point-of-need PCR test, which would deliver a rapid result. The initial intention for that was through community testing for the government. But we're also talking to Andrew and the tour. And what we did was convert the physio truck, the old physio truck from the tour, into a laboratory, and we took our own mobile laboratories that you can see at the bottom. Why two? Why two laboratories? Well, through summer of 2020, the UK Swing Tour was back-to-back tournaments. And so what we did was we'd park the large physio truck on a Sunday. Players and caddies and tour staff would arrive Monday, Tuesday, Wednesday, and we'd test the high volumes. And then that truck would move on to the next destination, leaving the smaller mobile laboratory to test symptomatic individuals through the actual tournament. Through the period of time that we were working over summer 2020, we needed to increase our throughput. We wanted to reduce the turnaround time down to less than 4 hours. And that included, if there was a positive sample, that we'd rerun it for confirmation. So we introduced a magnetic induction thermocycler, a Logic Smart assay, which both increased our sensitivity. Off the back of that, we were able to replicate that with the film and media industry, with other sports teams and sports events, and with consumers, such that we've been able to deliver over 3 million tests over the course of the last couple of years. So I'm going to hand over to Patrick, who's going to talk a little bit more about how the concept of the bubble evolved through the period of time that we're working.
Hi, everyone. I'm going to cover 4 slides in 5 minutes so that we can get to lunch. I'm going to speak about the 4 studies that Dr. Andrew Murray led to show that it was safe to play golf over the last 2 years at a professional level. The first to start off with was the 2020 season study, and we moved on then to look at contact tracing and a testing pilot, which we showed to be safe, and then we rolled that out in 2021 for the 2021 season, and then we concluded with allowing positive participants to play at the beginning of this year. So this was our first study, 23 events, 11 countries. We had 4 positive players out of 195, of which 3 were symptomatic. And on the bottom left-hand corner of the screen, you can see the process the players had to go through to make it to the field of play. And that was negative PCR before traveling to the event, negative PCR on arrival, discussion regarding contact tracing of any recent contacts with COVID, daily symptom checker, education, and a temperature check. And if you passed all those, then you played. Throughout the 2020 season, you can see the traffic light system of things that were implemented to keep golfers safe, and that was staying outside. Clearly the bubble was in play at this stage, but it was staying outside, using a mask, washing your hands, social distancing, so everything the WHO was recommending. And over that 2020 season, there was no player-to-player transmission. We then went on to look at, could something be done to mitigate against mass loss of players and caddies and staff going from event to event? Because golf is unusual in that players are coming from all over the world to international events to play, and it only takes one aeroplane to wipe out the entire field. And obviously that has huge implications both for the players in terms of their career and financially their own living, but also for the DP World Tour. So Andrew, along with colleagues on the European Tour and a number of medical experts, developed a strategy to mitigate the risk. So whether you were high, medium, or low contact, and high contact was inside for more than 15 minutes with a confirmed positive case, there was no discussion, you had to isolate, and we had a very few number of those. Medium risk were people, typically for this study, were people sitting within 2 rows on an aeroplane going to the event who were wearing their FFP2 mask, but they would get pinged, as we would say, and they would miss the event. But in this case, when they arrived at the event, they went through the usual protocol, which I showed you on the last slide, but they PCR'd on day 5 and they lateral flowed every day, and there were 23 of those. They were all negative across this event in Gran Canaria. And then the last were low risk. So this was shared outdoor space with a positive person, of which there was 2, and the usual medium risk protocol was put in place, but with slightly less frequent lateral flow tests, again, all negative. So then we went and rolled that protocol out across the course of the 2021 season, 26 events. There were 30 positive cases in 15 events, and you can see them on the right-hand side there. There were 163 contacts. Of those contacts, only 3 were actually positive. 2 were high risk, 1 was moderate risk. So if that study hadn't been used, we estimate that we probably would have lost 3 European Tour events in the 2021 season, which is an enormous loss to the Tour. And then to conclude, we then ran a pilot study with 2 South African tournaments where we allowed positive players and caddies to participate provided they were asymptomatic and they stayed outside, they wore a mask if they were inside, they socially distanced, and there was 1 high-risk contact who was negative. And now on the DP World Tour, on the European Tour, where we have continued to do that. But I think these studies just show that, I suppose, Dr. Murray practices what he preaches. He used the data to lobby government, to lobby public health organisations at every single country that the European Tour played at over the last 2 years, and everybody had different rules and regulations and different restrictions, but using the data, he was able to show that this was safe and it was outdoor and it was important. And I think that's just a big credit goes to him. This is 5 minutes, which is probably cost him a few years of his life over the last couple of years to go through all of this, so it doesn't do it any justice, but I'm pleased to be able to present it and show what he's led over the last couple of years. And I'll hand back over to Richard for some other aspects of Signpost.
Thanks, Patrick. So what about next? What about wider health implications, and how can we keep players healthy? Proud to announce that Signpost has signed a 3-year partnership with the DP World Tour, and we've become founding partners of the European Tour Health and Performance Institute. What that means is that we're able to attend different tournaments and work with elite golfers who lead stressful but active lives. We are able to join the travelling circus, as it was articulately labelled earlier today, where there's a lack of GP services, there's a lack of additional support for players and the caddies and support staff. So thanks to the foresight of Dr. Murray, who believes in the additional health services that we can provide to the tour, to the golfers. We're able to provide a cardiac and metabolic screen, as well as a skin cancer assessment. So players, caddies, tour staff, through the use of the mobile units that you saw before, we're able to attend a tournament and do basic in vivo assessment, heart, height, weight, body composition, blood pressure, as well as measure cholesterol, glucose, and assess any risk and offer advice. Our dermatologists are able to go on site and run both routine assessments every 6 months or every 12 months for the players, but also look at areas of concern that they may have. So since 2018, Sporting Skin, who are the partner organisation we work with, have done 650 consultations over 17 different events. And over that period, they found 35 probable BCCs. While it's not directly comparable, an Australian study from 2011 to 2014 found less than 1% BCC rate. The other interesting part is that the mean age of diagnosis of a BCC is 64, whereas the study with golfers was 40. We're also able to offer a wider, expanded blood-based analysis and health assessment for players, but wider into different organisations or into different sports teams, including full blood count, vitamin D, and ferritin that we're doing at the moment, and we're at Glen Eagles event at the Senior Open this week, running that for the players there, but also potentially into wider golfing community or wider corporate. Our own Signpost research has discovered that 75% of people since the pandemic are more interested in their own health, and 70% are more likely to get tested. So by having an agile and responsive service, we're able to deliver future screening services at the point of need. We can offer organisations an added value for their employees beyond insurance, which will hopefully increase productivity, reduce absenteeism, and increase health. And what we hope is that by publicising what we're doing with the elite golfers, we're able to encourage testing on a wider scale. I've also brought along an organisation called DeepX, who are downstairs in the main room. I'd recommend you go and speak to them, not least because they're right next to the fan, but also they are a teledermatology provider. And what I hope is that education sits above all with regard to skin cancer, and our ability to deliver a dermatology service at a site for the elite golfers works really well, but there's a big mid-ground, and hopefully a product like that will work. And I'd be delighted if anybody would give any feedback you may have. So in summary, you've heard how we developed a bubble, how we evolved that, and through what Patrick was talking about, how the numbers and how we could work the way through to get back to playing normally from COVID. We took science to the point of need, and we're able to deliver that mobile. And we're now able to use that for wider health, to increase, hopefully, the services for the tour, for the golfers. The other thing is we've talked quite a lot about the increased benefits of playing golf for health, but there is a risk of skin cancer, so education above all around skin cancer and also some screening. Thanks a lot for listening.